What is epilepsy?
Epilepsy is a chronic brain disorder that causes people to experience recurring seizures. What causes these seizures?
Most seizures are idiopathic, which means the cause is unknown.
These seizures can be caused by disturbed nerve cell activity within the brain.
Seizures can be divided into two main types, focal and generalized seizures.
Focal seizures have two subsections. Simple focal seizures affect only one area of the brain, while a dyscognitive focal seizure only affects a specific part of the brain. Less than 15% of people experience focal seizures.
Unlike focal seizures, a dyscognitive seizure can cause mental confusion, loss of memory, and loss of awareness during a seizure. More than 1/3 of patients with epilepsy experience this.
The second main type of seizure is a generalized seizure. Generalized seizures divide into several subsections.
These include tonic seizures, clonic seizures, myoclonic, absent seizures, atonic seizures, and tonic-clonic seizures.
More than 30% of people with epilepsy experience generalized seizures. Epilepsy can be caused by any of the following:
Neurological infections, head injuries, stroke, genetics,
brain tumors, brain damage from prenatal or perinatal care, and in many cases the cause is unknown.
A common myth of epilepsy is that it is contagious. Through research, this was proven to be false.
Seizure signs and symptoms may include any of the following: temporary confusion, a staring spell, uncontrollable jerking movements of the arm and legs,
Loss of consciousness or awareness, psychic symptoms such as fear, anxiety, or deja vu, but remember, symptoms vary depending on the type of seizure.
health risks associated with epilepsy.
Pregnancy complications. Uncontrolled seizures can affect the unborn baby. Epilepsy medicine may also affect the unborn baby.
Injury. You can injure yourself during a seizure, or when a seizure causes you to fall, drown while swimming or bathing, or have a car accident.
Emotional issues. People who have epilepsy are more likely to experience depression, mood disorders, and suicidal thoughts.
People who have epilepsy also have a small risk of unexpected death. Prevalence of epilepsy within the U.S.
1% of Americans will develop epilepsy in their lifetime.
About 2.5 to 3 million people in the U.S. have epilepsy.
Additionally, about 1 in 26 people will experience recurring seizures. Epilepsy can begin at any age. Studies have not identified a prime diagnosis time, but the incidence rate is highest in children and older adults.
Luckily, some children with seizures will eventually grow out of them.
Each year, 150,000 Americans are diagnosed with epilepsy. Americans spend more than $15.5 billion caring for and treating epilepsy every year.
Epilepsy affects people of all ages.
The more individuals learn about epilepsy and help to educate others, the better we will be at fighting the stigma and discrimination behind the disorder.
With early detection and proper care, epilepsy can be manageable, and the individual can live a successful life in regards to their physical, mental, and social status.
So, what brings you in today, Brandon?
Well, doctor, I've never really experienced seizures before, but recently I've had a few different episodes.
Seizures. Tell me what type of symptoms are you experiencing with these seizures?
Well, doctor, like I said, I've never really experienced them before, but 2 times recently my muscles have started to lock up. My hands, my arms, my legs, and it's really dangerous because I was thinking, what if I was walking at the time, or what if I was driving? So I really just wanted to kind of come in and get some more information about how I could manage it.
Well, your symptoms sound very similar to the condition of epilepsy.
Epilepsy. Well, so how would I manage that? How would I treat the symptoms?
Well, for right now, we can start off by prescribing you some anti-seizure medication. From there, we'll get you paired with a neurological specialist.
Why would I have to go to a specialist? What can he tell me that you can't?
The medication is only temporary, so with a specialist, we'll pair you up with him, and he'll get you to figure out what triggers your seizures and what parts of the brain are affected by these.
Okay, thanks a lot, doctor.
No problem.